All right. We're going to do one last video here for Unit 5 over on the physiology side, and this is going to be a little bit about the cranial nerves and their function. So in addition to the spinal nerves that branch off of your spinal cord, your peripheral nervous system includes cranial nerves, and your cranial nerves, as hopefully by now you've seen over on the anatomy side if you've been working on the nervous system anatomy, these are 12 pairs of nerves. So you have a left and a right of each one, and they branch off of, a couple of them branch off of the cerebrum, the main part of the brain, but most of them branch off of the brain stem. And each pair is given a Roman numeral designation 1 through 12, and then each pair also has a name, which I'm asking you to learn for the anatomy test. Also here on this slide, notice that most are mixed in function, and then 2 pairs are purely sensory. So mixed means a mixed nerve contains both motor and sensory fibers. That's what's meant by a mixed nerve. So within the same nerve, you're going to have bundled up axons or nerve fibers transmitting impulses from sensory neurons, incoming info, and outgoing motor info. And then in some cases, remember, motor impulses can be on motor neurons that are controlling skeletal muscles, or they could be motor neurons of the autonomic nervous system that are involved in controlling organs and glands and the heart in some cases as well. Okay, let's move along here. All right, here's your generic picture of the cranial nerves from your textbook. And you know, they're hard to identify when you're looking at a diagram like this on the underside of the brain. And when they're cut off, it makes it even a little bit harder to identify them. But you can see how these are arranged. And your first 2 pair are pretty obvious, as covered over on the anatomy side. Cranial nerve pair number 1 right there. Those are also your olfactory nerves involved in the sense of smell. And then cranial nerve pair number 2 are right there. And of course they would actually extend like this to your eyeballs, because those are your optic nerves, and they make that crisscross called the optic chiasma that sits right over the sella turcica, if you remember that from the sphenoid bone. And so those are the 2 that are the most obvious, and then the rest of them are paired off and start up at the top of the brainstem and work their way downward, and also in a little bit more of an anterior direction in some cases. Okay, so here's a table from your textbook which is showing you for each pair of cranial nerves, all 12, do they have sensory function, yes or no? Do they have motor function, yes or no? And this third column is reflecting whether or not they have parasympathetic function. And you can see most of them do not have parasympathetic functions. Cranial nerve pair number 3 does, 7, your facial nerves, 9, those are your glossopharyngeal nerves, and then 10, your vagus nerves. We'll talk a little bit more about that one more specifically, because that is an important nerve pair involved in controlling the activities of many of your organs in the thoracic and abdominopelvic cavities. Then you can see there on the table the ones that have motor function, yes, predominantly or maybe even exclusively, you're going to have outgoing impulses, efferent impulses that are controlling skeletal muscles, or if they are nerve fibers of the autonomic nervous system, they may be controlling glands and the walls of hollow organs. And of course, some are purely sensory, like the olfactory and optic nerves. There you see they have yes under sensory function, no under motor function. So those nerves, all of the axons in there are transmitting incoming impulses from the eyes and also the nose. So that just kind of provides you an overview. Check your study guide for Unit 5 for specifics about what I want you to do to prepare for the cranial nerve section of this unit. So just a little bit more about a few of the cranial nerve pairs. When you're taking a look, so your textbook has some pretty good tables where you can look over and read through the different functions of the cranial nerves. And also check out the testing, how cranial nerve functions are tested. And if you're going into nursing, you're going to encounter more of that in nursing school. They're going to review for you how to test cranial nerve activity in your patients. So the olfactory nerves, this is cranial nerve pair number 1. And olfactory, they're involved in the sense of smell. And the anterior ends of these nerves, you can see here in this diagram, are called the olfactory bulbs. So you have a left and a right. And the olfactory bulbs have little rootlets that extend downward through the holes in the cribriform plate. Remember the cribriform plate from the skeletal system? And these are your scent detectors. So they respond to different types of chemicals that we breathe in, and different types of sensory neurons within this olfactory bulb area will generate action potentials in response to different chemicals that they're smelling. And those impulses will head back this way toward the cerebrum and those olfactory centers in the cerebral cortex that are involved in interpreting smells and relating those smells back to past experiences. So those are your olfactory nerves, and you can see there the typical clinical testing that takes place is you ask a patient to sniff some sort of aromatic substance, and if they can't smell, that can indicate some damage to the olfactory nerves. Or if you look how they're squeezed up there on the underside of the frontal lobes of the brain, if a patient has a brain tumor, might be pressing on the olfactory bulb and interfering with the sense of smell. All right, then the optic nerves are pretty cool. We take a look at these. So these are large cranial nerves, and notice that, okay, so over here we got the right eye on our patient, and the optic nerve that extends from the right eye makes a crisscross over to the left side of the brain, and the one from the left eye makes a crisscross over to the right side of the brain. So the axons that are traveling through there, those action potentials that travel along those axons are generated in response to different wavelengths of light on the retina. That's what winds up generating those action potentials. And then those nerve impulses travel back this way on the underside of the brain, and they form synapses in here. There are areas within the thalamus. Remember, the thalamus is a routing center down there in the diencephalon portion of the brain. So there are synapses there, and then neurons there generate action potentials and send signals to appropriate parts of the visual cortex. So remember, your visual cortex is the part of the cerebral cortex in the posterior section of the brain that's involved in your sense of sight. So the optic nerves are kind of pretty cool. Testing, obviously there are various ways that you can test somebody's sense of sight, so you can read through how that's typically done. All right, another interesting pair of cranial nerves, cranial nerve pair number 8. These are your vestibulocochlear nerves. And vestibulo refers to the vestibule. Cochlear refers to the cochlea. So in each ear, in the inner ear, you have an organ called the vestibule, and that is involved in your sense of balance. And then you have another organ that it's connected to over here called the cochlea, and that is involved in your sense of hearing. And it's very interesting how these two little organs work. We don't have time right now to go over that topic, but it is something interesting to read about. That information is actually in chapter 15 on the special senses. So there are sensory neurons that are connected to the vestibule that generate action potentials in response to changes in your movement to help you maintain and interpret your sense of balance. And then there are sensory neurons connected to the cochlea over here, and they generate action potentials in response to different sound intensities and frequencies, and those impulses get transmitted through the vestibulocochlear nerves, cranial nerve pair number 8, toward the brainstem, and they actually, this cranial nerve pair starts out at the pons. That's where its origin would be located. And then, of course, there are going to be synapses and impulses that are going to transmit that information to the centers in the cerebral cortex that deal with hearing and balance. Okay, and you can see over here clinical testing. Hearing is checked by air and bone conduction using a tuning fork. So you may have had your hearing tested before with a tuning fork. All right, you may also have heard of somebody before having a cochlear transplant. So they, in some patients, they'll actually transplant that organ that's involved in the sense of hearing. Another cranial nerve pair I do want you guys to be familiar with, the vagus nerves. This is cranial nerve pair number 10. And these are very long nerves, so they branch off of the medulla oblongata, but then they actually extend all the way down into the abdominopelvic cavity, and there are lots of branches that come off of each of those nerves and send branches out to many of the major organs in your thoracic and abdominopelvic cavities. So the vagus nerves transmit impulses to organs like the heart and the lungs, the liver, gallbladder, stomach, intestinal tract, the kidneys. So these are kind of important nerves. In fact, if you read here in your textbook, it tells you right in there on homeostatic imbalances about these nerves. If both of your vagus nerves were destroyed, that would be incompatible with life. And the reason for that is the vagus nerves contain many nerve fibers of autonomic nervous system neurons that are part of the parasympathetic branch. So they're critical for helping you maintain homeostatic ranges of things like your heart rate, digestive activities, etc. So many of the nerve fibers within these vagus nerves are parasympathetic, so they're part of that rest and digest branch of the autonomic nervous system. So for example, nerve impulses that travel through the vagus nerves to the heart help return your heart rate down to a lower level for normal functioning, so it helps regulate heartbeat. Same thing with breathing. Impulses that extend out to your digestive organs help increase digestive activity. So these nerves are pretty important. I mean, imagine if you could not send those signals to your digestive organs, it would be very difficult for you to digest your foods properly. There also are motor impulses that travel through branches off of this nerve and extend to the muscles around the larynx that are involved in speaking. So if you have vagus nerve damage, it can result in hoarseness, the inability to speak properly and use those muscles that control your voice box properly. All right, so I just wanted to kind of go over a few highlights on a few pair of the cranial nerves. You guys can go through and check out in your textbook what the functions of the other pairs of cranial nerves, and do check your study guide for Unit 5 Physiology for specific assignments that I have in order for you to prepare for the Unit 5 physiology exam.